Mumbai. My topic for paper presentation today is Effects of an Awareness Training Program in Spiritual Medicine on Cognitive, Psychomotor and Psychosocial Functions among Healthy Human Volunteers. Starting with the introduction, the relevance of spiritual practices in health and diseases is well recognized, but its application in healthcare is lacking. The reasons being two primarily. First, spirituality is dismissed as superstition or quackery, resulting into its poor coverage in medical curriculum. Secondly, lack of information on evidence-based spiritual practice that separated from superfluous rituals or extremist concepts pose difficulty to apply sound spiritual practices in medical practice. Having been convinced about immense health benefits of spiritual practices, the next challenge for medical practitioners is to secure required cooperation from the patients for their indulgence and involvement in healthy spiritual activities. To facilitate this, we prepared a PowerPoint program detailing on evidence-based spiritual practices, which not only describe types of useful spiritual intervention, but also throw some light on underlying mechanisms responsible for health benefits. The purpose of this presentation was to sensitize prospective subjects on current developments in science and technology in the field of spiritual medicine. Objectives of the study were to assess and compare the effects of an awareness training program in spiritual medicine vis-a-vis control on cognitive and psychomotor performance using psychomotor test battery in healthy human volunteers, to assess psychosocial status as a result of the awareness training program in spiritual medicine using a set of questionnaires, to promote student wellness by reducing anxiety, enhancing well-being and self-esteem, to validate newly introduced tests for self-esteem with already established ones, to appreciate the relationship between mental and physical health. Methodology used for this was the study design. It was a randomized controlled parallel group study. Study site, it was conducted at Grant Medical College and Sir J.J. Group of Hospitals. Study population was constituted by 40 healthy male or female medical students pursuing MBBS course at the institute in the age group of 18 to 25 years. Two groups of 20 volunteers each, 20 study group and 20 control group, constituting a total of 40. Inclusion criteria was healthy volunteers aged 18 to 25 years having the ability to understand the requirements of the study, willing to give consent and ready to follow the study procedures. Exclusion criteria was subjects unwilling to give consent, engaged in any special type of spiritual practices, having significant history of physical or mental illness, and also subjects having any forthcoming events such as examinations during the entire study period, which would grossly affect the daily routine. Data collection, the volunteers were divided into two groups of 20 volunteers each. Baseline measurements for cognitive, psychomotor and psychosocial functions were made. All volunteers were given a lesson in meditation by a spiritual practitioner. Subjects had to do meditation daily for 15 minutes twice a day for 2 months. In addition, the study group was given a PowerPoint presentation as mentioned above. Post-study measurements for cognitive, psychomotor and psychosocial functions were repeated at the end of 2 months for both the groups. Psychomotor test battery we used included test for attention, test for cognition and questionnaires to assess psychosocial functions. Test for attention used for visual reaction time, choice reaction time, visual reaction time using stopwatch and critical clicker fusion test. Test for cognition included computer-based memory test, digit cancellation test and digit letter substitution test. Questionnaires were used to assess anxiety, cognition and self-esteem. All the questionnaires were standardized. Results, compliance. Talking about the results, compliance, study group was compliant with meditation practice in the range of 83% to 90%, whereas control group compliance ranged from 48% to 90%. There was significant difference between pre and post scores in study volunteers and standard psychomotor test. Level of significance chosen here was P less than 0.05. Significance differences were also recorded in pre and post test scores of study volunteers in standard cognitive function tests. On psychosocial status, using standard questionnaire, the study group showed significant difference in pre and post score or anxiety levels, for which P was 0.042, cognitive failure for which P-value was 0.005, and self-esteem for which P was 0.006. Control subjects did not show significant difference in pre and post score in most of the tests. This is the table of the results. The ones marked with asterisk show a change. All the psychomotor tests did show a significant change except for visual reaction time 2 and choice reaction time. All the cognitive function tests did show a significant change. are the graphs showing post and pre-comparison. The blue one is marked with post, which shows a significant change in the study case group, which is the study group, for cognition questionnaire, and finally for anxiety level questionnaire. Conclusion: awareness-based training program in spirituality facilitated compliance for spiritual practice. There was a significant improvement in cognitive, psychomotor and psychosocial functions within a short period of time. It appears that investing some time in spirituality out of the busy schedule might improve brain powers, which can be utilized to carry out work more efficiently, besides the possibility of keeping the mind young in a child body. These are few of my references. Thank you so much.
Thank you, Mr. Which year student you are?
Sir, I am in final year.
Very good. Do you think, with a significant improvement in various psychomotor functions, cognitive functions, self-esteem?
Yes, sir.
Do you think for all medical students?
Yes, sir.
It's a 15-minute session?
Sorry, sir?
How long it was the each session?
Sir, 15 minutes of meditation for a duration of 2 months.
So just 15 minutes, right?
Yes, sir. Just 15 minutes.
So I think 15 minutes session should be included, for all the medical students.
Yes, sir. Absolutely.
Thank you.
Why did all these functions improve? What do you think happened?
So actually the thing is, the study group was shown a PowerPoint presentation explaining the mechanisms which in spiritual medicine which can provide health benefits. So if they are explained the reason how spirituality can provide health benefits, then the compliance is more and the tests also improve. But whereas the control group, we did not explain them the reason. We just asked them to perform meditation. So it's like if you're explained well, then you actually tend to do more and you're more compliant. Thank you, sir.
Thank you, Nishtha. Judges, we will be ending the second session of the paper presentation right now. We have a TRINITY oration. Dr. Quresh Maskati is here.
Today, we have amongst us Dr. Quresh Maskati. He is the current President-elect of All India Ophthalmological Society and former President of All Maharashtra Ophthalmological Society and Bombay Ophthalmologist Association. May I request my colleague to welcome sir with the sapling. Sir is the youngest person in the history of these three societies to hold this post. He has super specialized in diseases of the cornea and anterior segment microsurgery from London, Boston and Rochester, USA. Currently practicing at the Maskati Eye Clinic and attached to the Wadia Children's Hospital, Selfie Hospital and Habib Hospital as honorary consultant eye surgeon. Sir is the only ophthalmologist in Asia having had extensive experience of the pin-to-cheek keratoprosthesis, owing to which he has successfully restored vision to blind patients in Colombo, Karachi, Lahore, Dhaka, Kuala Lumpur and Manila on invitation from the local eye surgeons. He shall be speaking on the last lecture, LRND Posh.
Hi, as we've had a lot of our batchmates come here, one more, Dr. Quresh Maskati. I think if you guys haven't heard that, he's a wonderful guy, very entertaining speaker, and president of the Indian Ophthalm Association. I've come here not for that, but just to say that he's become a proud grandfather today to a little girl called Mara. Congratulations on behalf of everyone.
If I press something, by magic something will happen. No? Leave that. We just got the lights put out. Okay. It's great being back in Sion. I used to come here a lot when I was courting a girl from Sion, myself being from KM. When I was an undergraduate like you, I had a girlfriend from Sion, so many hours were spent in Sion. And the first thing that happened when I came in now after so many decades is a pretty girl pushed a pin close to my heart and it felt like home. This lecture is entitled The Last Lecture, not because it is the last lecture chronologically, but because of this guy called Randy Posh. In 2008, he delivered a lecture at Carnegie Mellon called The Last Lecture. That was because he knew he was dying, and he died shortly after giving this lecture. He had 10 tumors in his liver. I have not had a CT MRI of my abdomen done, though Suleiman is a classmate. He was fitter than I am when he delivered his lecture. He demonstrated his fitness by doing push-ups on stage. At the moment, I have 1 ear which is deaf with fluid in the middle ear with a hoarseness of voice. So I am nowhere near as fit as he was. He was also 9 years younger in 2008 than I am today in 2015. The only things we have in common are that he spoke from the heart, something I will attempt to do so as well. Let me take you back a few years. In school, I was an introvert. I was studious, but with very few friends. In pre-medical school, that's St. Xavier's College, I decided it could not continue like this. Also, it was an all-boys school, and suddenly for the first time, I saw a species called girls. So I went the other extreme. So by the time I got to medical school, corrections had occurred and I was into inverted commas normal. The take-home message is that all those who tell you you cannot change your basic nature are talking gibberish. I have changed from introvert to extrovert to so-called normal in a span of a few years. So everyone who is an introvert today can become normal later on. My life in medical college was stormy, to put it mildly. I was almost thrown out of college on 5 occasions by the dean in my undergraduate years. Did not compromise on my ethics or my beliefs, even with death threats. We had, I remember, an intermedical drama competition, undergraduate. And from GS, we were few of us, because GS was then known and perhaps is still known as a college of geeks. So we had people, very few people were willing to leave their books aside to come and attend a drama competition. So we were about 20 of us. I was the general secretary, and we were about 20 of us attending there, and there were about 200 people from Nair Hospital cheering their drama. And our boys made a little fun and giggled actually in serious parts of the drama. So during the interval, some of the big guys from Nair came and bashed up some of the 4 feet nothing guys from KM who had books in their hands to read during the interval. So we were bashed up. We went to the police station, recorded a complaint, and ex-cyanide, Dr. Lalita Rao at that time, head of IMA, pleaded with me, don't register a police complaint because exactly when you want to give your exam, they'll call you to court. So we withdrew the police complaint, but then went to the dean of Nair and complained to his house, then came back and told the dean of KM. And his favorite, he's no more, Dr. C.K. Deshpande, his favorite, his hand would go like this. So are you the dean or am I the dean? And I wouldn't know where to ask him to stop. I think we should throw you out, but so the next day I went around KM telling everyone that it's only because we were 20 and they were 200 that they could do this to us. So the next day, 350 people from KM, unheard of, attended the drama festival where we had our English drama going on, which was so bad that even I wanted to boo. But it was heard in pin drop silence by everybody, and I just received a few death threats. This is the pre-mobile era, so on my landline I received death threats. So some of our boys from KM went with brass knuckles, small chakus, confronted the Nair people and said, if Quresh is harmed in any way, we will find you in your gully type of thing. And all the other things well. I followed the footsteps of my father, that's my father there, who was threatened him similarly to write a false certificate. He refused when he was a resident, and I followed in his footsteps. I graduated at first attempt, though it doesn't seem that way now, but one of the examiners insisted I should be failed in my MS ophthalmology because she had been failed when she appeared for her MS many years ago when Dr. Maskati Senior was examiner. Something she told me. Curiously enough, after I passed, I worked for a year as lecturer under her, and she told me this very proudly, you know, your father failed me, so I thought I should fail you. So the external examiner from Mangalore agreed, but insisted that those who failed worse than me should also be failed. That would have meant failing everybody from Nair, so she relented. As a resident, I never bunked on emergency days, did not want anyone to have a chance to say Quresh is not following rules because he is the boss's son. Boss was head of department ophthalmology, my father. But then it's good having a father as head of department, also very lousy if you get a foreign body in your eye. Because I got a foreign body in my eye at about 8 in the morning, went to the ophthalm OPD, and the houseman took a look at it with an old torch which hardly worked and says, you know, I think you got a foreign body in your cornea. I'll show you to registrar. So registrar took one look with a better torch and says, you got a foreign body in the cornea. I'll show you to lecturer. So lecturer took me on the slit lamp and looked at it and said, you got a foreign body in your cornea. We'll show it to professor, assistant professor. Assistant professor took me to the brand new slit lamp which had come in the department and confirmed that you got a foreign body. Now we wait for boss. Boss being an honorary, in those days of honoraries being allowed, normally attended at 12 noon. So in between I'm sitting there with a khatak and a foreign body pain in my eye, and I see 30 other patients walking in, poor, garib patients, getting the foreign bodies removed, going home happily ever after. So boss comes at 12 noon and they show him, show me as prize patient number 1. He looks at me and says, Quresh, you got a foreign body in your eye. Turns around to the lecturer and says, go remove the foreign body. I started private practice in '86. Unfortunately, shared the waiting room and secretary with my father who had a 30-year head start on me, ensuring that the chairs on my side of the waiting room were always empty. In my opinion, lest you feel that I've come here only to talk about my days, let's get back to the topic of little bit of inspiration. Who is a leader? A leader is somebody who is a role model for his peers and his juniors, is someone his or her family is proud of, has a vision to serve society, and is passionate about creating future leaders. I would rate Dr. G. Venkat Swami, who started the Madurai Eye Hospitals, the largest chain in the world, and Dr. Abdul Kalam Azad, who's giving him a Padma Bhushan, as two great role models. But closer to home, you have two role models of your own, whom I'm sure you recognize, who are leaders in the true sense of the word. They motivate you by their own example. Let me share with you some values that I believe in. And these are the 10 values that I'll be talking about. That's a picture of my wife. She has got nothing to do with any part of this conversation, but she normally insists that wherever I talk, I must put up a picture. So the first one is goal setting. You should have a long-term goal, let's say realistic short-term goals. Long-term vision, but short-term goals to achieve them. Once you achieve them, you set a new goal. You cannot be an undergraduate now and say that I will have 3 Mercedes cars in my garage tomorrow. It doesn't happen unless you steal them. So you need to say that as an undergraduate, my short-term goal is that I will do well in my studies. I will pass out. I will either become an excellent family physician if you want to get the Mercedes faster, or I will go in and become a postgraduate and after 1,000,000 years will get a Mercedes. Whatever it is, you need to set realistic goals. Don't think about failure. Be positive as Tiger Woods was in his prime days, not now, but in his prime days. Extremely positive, won almost every competition that he entered because he was extremely well focused just on the next hole that he was going to hit. Didn't think about winning the competition. Fear is an illusion. Whenever you try and think positive, there's always the fear of failure. I tell you that fear is an illusion. You imagine obstacles instead of opportunities. The chasm below over here instead of the cliff edge on the other side. You see in Hindi movies where the hero is always on a white horse, never on a black horse, white horse and galloping away, and he's got a whole posse of people, whether it's a Hindi movie or a Zorro type of film. He's got everybody chasing after him, and his horse is the one that manages to jump across, while the cops and everybody stops on one side. That's because they have the fear, while this fellow imagines life on the other side. So don't look down, look forward, and you'll be able to overcome most obstacles. There is a story of the king's falcon in the good old days in Arabia, before the oil came in and spoiled everybody's life. They had these hunting falcons who would be prized possessions and would cost a lot of money. And there was this prized hunting falcon which had excellent pedigree, but wouldn't get off the branch. And whatever the king did, he couldn't get the falcon to fly. He asked all his wazirs, all his wise men, and none of them could help him until a poor farmer came across and said, "Sir, may I?" And everybody laughed and said, "How will you get that falcon to fly?" So the farmer had a sickle in his hand, he simply cut the branch. The falcon had two choices, either fall down or fly, and the falcon flew. So don't wait until somebody cuts the branch under you. Change is going to occur. You need to be ahead of change. You need to fly before somebody cuts the branch, because life is very cozy, especially when your parents are paying for your education. But at some point in life, you need to rise ahead and you need to look forward to change. Don't fear change, welcome change, because change is going to happen for everyone. The second value is consistency. Strive for perfection and work hard. You need not be the best person in your batch, or the smartest, or the most charming, or the most popular. Just be consistent in your behavior and approach. Unlike the carpenter, there was this carpenter who was the best carpenter in an architect's office. And he was close to retirement, and he went up to the architect and said, "I'd like to retire now, sir. I've touched 60. I've worked for you for 35 years, and I now want to retire to my village." So the architect says, "There's just one job which is left. Please finish that one job, and then you can retire." And he told him to build a house and gave him the specifications. This carpenter was so annoyed. Carpenter had been an excellent carpenter for all these years. He was so annoyed. He used substandard wood, he used substandard nails, he used substandard screws, and was in a tremendous hurry to finish the job. Finished it, went up to the architect and handed the keys and said, "Sir, the house is ready now, can I retire?" And the architect says, handed him back the keys and says, "This is the house that I got built for you. I knew nobody else would be able to build a better house than you. So this is your own house." So what happens when you're not consistent is that sometimes you dig your own grave. So be consistent, whether it's the first patient you're seeing in an OPD or the last patient you're seeing in the OPD. That patient has done no harm by being the last patient. Be consistent in your approach. If you smile well in the first patient, smile well for the last patient as well. Be as thorough and clinical in your examination. And in life, when you go out into the big bad world of private practice, it will serve you well, because the patient will say that the doctor was as fresh with me as he was with everyone else. Patients are paid the same, or whether it's a free patient or a paying patient, every patient deserves the same consistency of approach. Don't give excuses. Strive towards perfection like the sculptor of an idol who kept rejecting each piece. And finally somebody went up to him and asked him, "Where is this small idol of Ganesha going to be?" And he says, "It's going to be on the top of the spire right up there." So the passerby told him, "But then why are you rejecting everything? Right on the top of the spire, nobody will be able to see it." He says, "Every day that I pass by, I will know that it was not perfect." So work hard and practice whatever you do, whether it's a case presentation or a surgical step. Things don't happen magically. You have to practice in the cold comforts of your room, undergraduate room. Practice for your case presentation, practice for whatever you're doing. The more cases you do, the more you do. We had somebody who as an undergraduate, a classmate of ours, would go around into the wards in his spare time just giving intramuscular injections. So he would tell the nurses that, "Let me give the injection." So much so that patients started asking for him over the nurses whose job it was, because he became so good at his work, just because he continued to persevere. He's just now a very, very successful family physician. The third one is stand for your convictions. There was a chief executive officer who wanted to appoint somebody to take over after him. So he gave each of 10 executives a seed for a bamboo plant and told them, "You go home and you nurture this seed and grow it, and whoever grows the best bamboo plant, I will appoint as an as in my place. So everyone took the seeds home, and 2 months later they all came with good-looking bamboo plants, and the CEO came and measured the length of the bamboo plant for each one of them. Only one man came there with an empty pot, and everybody started laughing at him. So the CEO asked him what happened. He said, "Sir, I don't know what happened. I watered it, I put fertilizer and everything, but the bamboo plant just didn't grow." And you can imagine that finally, of course, he was chosen there because the CEO said that I had boiled the bamboo seeds and no bamboo could have ever grown in any of these. So the other 9 were fakes. This was the only person who stood by his conviction and rose to become CEO. And if you believe in honesty, stand for your convictions, it will always serve you well. I was caught talking on the cell phone once when I was driving. You know that every ass has a cell phone now. So I was caught once at a traffic signal on the cell phone, and the cop came up to me, obviously looking for a bribe, and obviously I wouldn't give it to him. So he took my license, and the rule at that time was that when he takes your license, the next day you can send your driver or anybody and pay the fine in the police station, and you get back the license. So I sent my driver, but that day somebody had called Quadros or something had killed Alistair Quadros or something, had killed some 5 or 6 people on the roadside drunken driving. So overnight the government changed the rules and said those caught drunken driving or with cell phones on while driving will have to appear in court. You can't get back your license. So my driver called me up from there to say, "Sir, the bribe amount has now gone up to 200 rupees if you want the license back." So I said, "No, what is the rule?" He says, "No, you have to go to court." So at 7 in the morning on a particular day, I went to court where I was the only person in a suit. The others were 7 taxi drivers there who had been hauled up for various offences. My turn came, I stood up in court, I pleaded guilty, I was given a 500 rupee fine and was banned from driving for 7 days, which I cheerfully did. But I stood up for my convictions that I will not bribe anyone. So it's small things like this. If you want, don't ever talk about honesty, don't ever talk about trying to clean up or make India beautiful, or criticize your country if you yourself are contributing to the filth. So don't throw kachra on the road and don't bribe people. That's the least that we can do if we want our country to come up. The fourth one is give without expecting a reward. This is enshrined in the Gita. Do what is right without bothering about a reward. I wish I could recite Sanskrit shlokas. This is a very easy shloka, but I am lousy at Sanskrit. So it tells you that whatever you do, don't expect the reward for what you do. You will get back something in life. There is the story of Paderewski. Paderewski was a very famous pianist in the US. And there were 2 impoverished students, Herbert Hoover and another friend. And the 2 of them wanted to make some money for their college education. So they went up to Paderewski, who was that time already famous, and said, "Sir, will you play the piano in our college? We'll sell tickets and we'll give you $50 from what we earn. The rest we'll keep for our college education." And little did they know, this was in the time of the Great Depression, that students had better things to do than spend money on foolish piano recitals. So the recital was a big flop. No students came there. And these fellows couldn't afford the $50 to Paderewski. So they gave him $25, which is all they had in their own pockets. And Paderewski said, "No, you keep it, it will be useful for your education. I don't really need the money." A few years later, Paderewski migrated and became the president of Poland. And Poland faced a huge famine. And Paderewski appealed to the US for help. And at some point, you're supposed to give me hot water. Somebody was supposed to give me hot water. So Paderewski appealed to the US for help, and the US sent shiploads of wheat and grain and other things to Poland and brought it out of its crisis. And when Paderewski asked, "However can I pay you for this?" This is Paderewski, this is Herbert Hoover, and Herbert Hoover was by then the president of the US, said, "Sir, you already paid in full." So when you give without expecting a reward, you get back much more than what you ever imagined you would. Value yourself and others. Thank you. Thanks. Each of us is unique. You see these Coke bottles, only one is a genuine Coke, the others are not so. They all look alike, we all look alike, 2 arms, 2 legs, two hands, but all of us are absolutely unique. We are all like diamonds waiting to be polished. Imagine a 100-rupee note, you crumple it, you soak it in water, you run a road roller over it, you put it in the mud and allow people to stomp all over it. Even at the end of it, if you take that 100-rupee note and go to the bazaar, you'll get 100 rupees worth of groceries. So the same thing is with us. All of us are like that 100-rupee note. Sometimes our bosses stomp all over us. Sometimes our teachers tell us you're good for nothing, you'll never make a doctor. Sometimes our friends and colleagues are continuously laughing at us because we wear glasses or because we are fat or thin or whatever. But if we have our innate self-value, that we are like that 100-rupee note, no matter what it is, if we know our value, nobody can take that value away from us. So I urge you to remember that all of us are diamonds, you and me are all diamonds waiting to be polished. Even if we are never polished, we will still be like that 100-rupee note whose value is forever. Henry Ford was a very famous industrialist. At a young age was a milk delivery boy. So what would happen is, this is talking about the 20s and 30s, the milk van would move from house to house and people would keep containers outside, empty containers on their porch. And Henry Ford would jump down from the van, take the container to the milk van and pour the milk as required into that vessel, put it back, get into the van and go to the next house. And later when he became a very famous industrialist, people asked him, what lesson did you learn as a milk delivery boy? And he says, one very, very important lesson which I learned was that no matter the size of the container, the shape of the container, some had narrow necks, some had broad necks, some were broad vessels, some were small vessels, no matter the size or the shape of the container, the cream always rose to the top. There was a professor who called his students over for a cup of coffee and he kept different coffee cups there. Some of them were good looking cups, some were little cracked, some were chipped on the side, some had saucers, some didn't have saucers. And he found that people picked up the good looking cups first. And he told them that I call you home for coffee, the coffee is the same in every cup. So if you value the coffee, not the cup. When you are working, when you go out in the big bad world and you have employees under you, or you become a full-timer or a professor or a dean and you have people under you from class 1 to class 4 employees, value the person inside, not his uniform, not what he's wearing, not what he shows from outside. Every person is unique. You value that person, you'll get the best out of that person. So never go by external appearance, go by the inherent qualities of a person. The sixth is ask for advice. All of us are not supernatural, we are not God. We need advice, whether it is from Google Mail or from your colleagues. You need to be advised. Don't be pig-headed, be receptive to criticism, take help when necessary. Be ethical. It's more profitable, I assure you, in the long run, having been there, done that. Patients will realize you can't fool all the patients all the time. That picture there says a man which got arrows all through, and this guy looks at the computer and says your cholesterol really has me worried. You know, so the patient comes with A ailment and you diagnose B ailment because B ailment is more affordable, makes more sense. For example, in our field in ophthalmology, patient comes with a little diminished vision and all he requires is glasses and patients are told that you have cataracts waiting to be operated. If you don't operate tomorrow, you'll go blind. So because the cataract extraction is more paying than prescription for glasses. So don't do that. You can't fool all the patients all the time. I've got a reputation for patients come to me when they want a second opinion because somebody has told them that they've got a cataract which you need to operate tomorrow. And they come to me and I tell them, see me after 1 year, here's new glasses. So what happens? That person has lost a patient for life just because he's unethical. And you need to be a role model as you grow up and have families of your own. You need to be a role model for your children. For example, when we went to an amusement park, my father paid for a full ticket for me as I was just above the age limit for a half ticket. My uncle asked him why, and he says, because I was quite short at that time. He says, you could have easily bought a half ticket. He says, no, but he would have known, like the sculptor with the idol, he would have known, that means Quresh would have known that I cheated. And what kind of a role model would I be? So be a role model. You never know when you're old, not only for your kids, but for your peer group, for outsiders, by your very actions. You will be a role model for so many people and will help bring up our magnificent country. Then there is collegiality. Collegiality is how you behave towards colleagues. Unfortunately, this is more the norm. Somebody passing by and you dropping in. Typical when in the big bad world of private practice, when a patient comes with a complication, the second doctor says, "My God, which butcher has operated upon you?" Instead of that, you need to tell the patient, "Let me see how I can help you." Share your knowledge or expertise with others. Don't keep it to yourself. It's very pathetic. I've been going around as president of my All India Ophthalmic Society all over the country. And I find that some of the teachers, the professors, are not willing to impart the latest skills, though they know them, because they feel that the student will go out and become a competitor. No student ever is your competitor. Students will send you patients for second opinions. And you need to be proud of your own knowledge in yourself and have self-worth so that nobody is your competitor. You yourself should be your own competitor. So share freely your knowledge or expertise. Share your clinic or equipment with others when you finally leave the portals of LTMMC. Teach if possible. The best way to learn yourself is to teach, because you cannot teach without reading. The more you read, the better teacher, the better student, and the better a student, the better you are with your patients. And value relationships with colleagues, because it's like an egg. Once broken, it's difficult to restore. I mean, I'm an excellent surgeon, so I did this, but not all of you will be able to do that. Empathize with your patients. Patients will forget what you said or what you did, but will never forget how you made them feel. You could have a patient in the last stages of cancer or whatever. Put a hand on their shoulder, literally when appropriate, same sex. Otherwise you get into trouble. Figuratively always. So don't be very, very enthusiastic about this bear hug type of thing. But somehow, whether you put an arm around the shoulder or by your words, you should be able to communicate with every patient of yours that you feel their pain, their discomfort, their stress, and you're doing all you can to alleviate their misery. Then even if you are the cause of the pain, because you caused the complication, they'll still be with you because you're showing sincerity. Don't run away from your patients. Patients are the reason why you're in college or in practice in the first place. And practice patience, you will get patience. Do not let anything frustrate you. Whether it's a complication post-op or a lack of patience queuing up at your doorstep, in spite of you being the best physician or surgeon in the world. Don't give up on your dreams, your values, or your patients. Do the utmost you can to restore their health, even if it means sending them to someone else, and especially if you send them to someone else. Again, this art of getting a second opinion at the correct time, you will never lose the patient whom you send. Patient will always respect that this is the amount you could do. You sent me to your senior colleague, but at least you recognize your limitations. I got better with your senior colleague. I'll come back to you with my family because I know you'll never mess up with me. That's the impression you give when you take a second opinion. Moving on from goals and values is how to be happy in your personal life. There are two ways. This is one way, but it's short-lived, and I believe, I'm a teetotaler, but I believe that it gives a terrible hangover the next day. We have two types of partners. The busy one who's too busy with his work, no time for anyone else. Or the non-busy one who's too busy trying to become busy and therefore no time. So basically all doctors have no time. Busy ophthalmologists, these are some of the examples. Robin Cook, author of Coma, ophthalmologist. Ken Kenyon, a very famous cornea surgeon under whom I trained in Boston, who runs a marathon till he was 70. And this guy with the unpronounceable name, a very famous vitreoretinal surgeon in Europe, who was an expert gardener in his spare time. So people found things to do. So how to be happy when old? Cultivate friends now, cultivate outside interests and hobbies now, spend time with the family now, spend some quiet time daily with yourself from now, and exercise from now. That says what fits your schedule better, exercising an hour a day or being dead 24 hours. Cultivate friends. They should be friends, not colleagues from the same branch of medicine. So this is your golden time. When you have friends, true friends, what we call chatti buddies, from the undergraduate days, these are the friends you must remain in touch with. Also your pre-medical college days, your school days, because those are genuine friends. They've seen you before you become rich and famous. Once you become rich and famous and you become a famous ophthalmologist, your fellow ophthalmologists are your colleagues. They're not your friends. Secretly, all of them are wishing that you follow up on a case so they get more patients. So through Google, you can reactivate your school and college friends, make efforts to meet regularly, go for short vacations together, maybe once or twice a year. Join a Rotary club. I am a Rotarian, so I believe there are some other service clubs also. But being a Rotarian, I'm just telling you about this. So Rotary Club, Lions, JCs, these are places where you meet non-medical people and get a chance to know the world outside. Otherwise, you get so cocooned in the medical world with all its frailties that you don't become a complete person. So gather maximum friends now. They will serve you in good stead when you grow older. Then cultivate interests and hobbies. It could be stamp collecting, coin collecting, or even reading non-medical books, of course. Don't be a geek. Luckily, you're in science. Music. Listen to music or singing or learn playing a musical instrument. I have a music teacher who comes to my house every Tuesday night at 8 o'clock. Since I don't manage to get home before 8:30, he is very thrilled because the 1 hour music session is only half hour and he gets paid for 1 hour. He's told me that, sir, I don't practice any time outside. He plays the harmonium while I sing. We start with bhajans, we start with ragas, then go on to bhajans, then go on to Jagjit Singh ghazals, end with Mohammad Rafi. And when I sing Chaudhary Ka Chand, he knows that it's the last song, he can leave after that. It's a pretty set routine. It has been like this for the last 10 years. And he's told me that, sir, you haven't even graduated from 5 ragas. Even now, if he says, let's do Rag Yaman, I have to open the book and find out whether Sa follows Ra or the other way around. So he says, sir, you'll never be able to sing in public. And I tell him that's not my aim. I just enjoyed that 1 hour of singing. And earlier I was not allowed to sing in the bathroom. Now at least that 1 hour I can sing in peace because I'm paying for it. So more than singing, though I'm still a lousy singer, I appreciate songs that much better. And this is something you can do later on in life. It could be art, it could be dancing, any type of dancing. It could be sports. Preferably don't become very good at team sports like football, hockey, because when you're 93 years old, your teammates will have died. So pick up sports like chess or swimming, where you don't need people. You can play with your grandchildren and they'll beat you every time. Take lessons if you wish. As I said, I'm doing it. You can do it at any age. And devote a fixed amount of time to that activity. It gives you a lot of pleasure. Spend time with yourself. Have at least a 15-minute time where you spend with yourself, preferably at a fixed time and a fixed place every day. Since I hardly have any patients of my own, I could do it any time during my clinic hours. But some of you all might get busy in practice, in which time take it out from your non-practice hours. Look back at the day gone by, plan the next day. You can even use a paper and pencil. And ideally spend some time in meditation. Now these are two different things. The last speaker in the previous session talked about meditation. I only heard the question answers. But spend some time in meditation. That is when you're without paper and pencil. These are two completely opposing things. The first one, which I said, spend time with yourself, is an analysis. So you're actually thinking about the day gone back, see what wrong you've done, how you can improve on yourself, become a better person, plan ahead. The second one is where you actually empty your mind of everything. You can concentrate on a rose or an om or whatever it is, but empty your mind of the clutter. That could be another 10 minutes, 15 minutes, 5 minutes, whatever it is. So these are two separate things opposed to each other, but both of these will give you a lot of clarity in your mind. Then be detached. Care for your patients, yet realize you have a life outside of medicine. Don't be so involved in your work and caring for your patients that you worry and fret about every patient that you operated and don't sleep at night. Be ambitious. Aim to improve your financial status, but by honest means, you must be able to provide adequately for your family. Yet realize that making money is not your sole purpose in life. Most important thing is to be happy. This was a fire which completely destroyed my clinic in 2009. I had to build afresh from there. Bought one instrument at a time as I could afford it. But I was detached. I knew what had to be. Que sera, sera. Still remain happy. So happiness comes from within you. It doesn't depend on the climate. It doesn't depend on whether your toast was burned in the morning. It doesn't depend on whether your clothes were creased or a complication that you had in office or some patient who abused you. None of these things should penetrate your inner core. You're a little detached. You need to be happy from within. If you're happy from within, you will always radiate happiness and perhaps infect those around you. To end with a cricketing analogy, since the World Cup is around the corner, success is like a century, strive to achieve it. Problems are like Yorkers, face them. Failures are like bouncers, leave them. Luck is like a full toss. If it comes to you, use it. And opportunity is like a free hit, never miss it. To summarize, we discussed the importance of certain values in our personal and professional lives. We learn that to be happy in our professional life, and when we grow old, it is important to develop a life beyond our professional one. We realize the importance of friends, family, and spending time with ourselves. I assure you, I have not told you anything that I do not follow myself. You are free to apply any or none of the take-home messages in your own lives. Thank you very much for your attention.
Thank you, sir, for such an amazing lecture. And I request our Dean, Dr. Sumana Martin, sir, to give a total of applause.
I wanted to say, wouldn't this be entertaining? मजा आया कि नहीं भाई? I'll share a few secrets. I learned a new secret about Quresh, which I probably have to share with his wife. The secret girlfriend at Sion Hospital. A little bit of trouble for it. But jokes aside, I have to tell you about the grand play that we all went from KM, which Quresh told you just now. 350 KMites went to support a very miserable play. I have to tell you about the play so that any artistically inclined students know that this is not the way to go. The play was such, 20-25 minutes, I think, full-length play. Nothing happens. There's a idea over there. One guy sitting out there, female sitting on this side, I think Bobby and somebody else. For half an hour, nothing happens. I'm the music director, so I have to take care of a lot of music, lights, all of that. In the end of the play, there is one line, beginning and end. Let's have a baby. This was the most brilliant play in the guy who designed it. But all of us knew how crappy that was. Unfortunately, this friend had aspirations of becoming a movie director. So we had to support him. And luckily all this incident happened, so we turned adversity into good things and we ensured nobody booed. I don't think we got a prize or anything, but that was it. Secondly, about Quresh, I must tell you, be the change that you want to see. He's always dressed impeccably in a suit. I'm on a suit just for conference days. He'll get off his car if he notices somebody throwing something on the street. Three-piece suit guy picks up kachra from the road, knocks on the window of the car. Sir, I think you've dropped something. That is Quresh for you, and that is all of us can be the same. In fact, some of us can go even more because you're BMC guys. What I do is if somebody tears a piece of paper and throws, that really annoys me a lot because one piece of paper somebody can pick up. If you tear it into shreds and throw, that becomes a big deal, right? So I catch that guy, I tell him I'm a BMC official. I'm a BMC official anyway. So I'm authorized to fine you 2,500 rupees, whatever my mood says. But I'm not going to do that as this is your first time. So at least next time to kuch karenge. This is tearing papers and throwing. So I think guys like Quresh can make a tremendous difference. I thank him once again for coming here. Congratulations once again on this lovely granddaughter, Naira. And I don't know whether she's an ophthalmic surgeon, but if she is, so like her granddad and great granddad. We had some, his father was my teacher too. And he was a very entertaining guy. We learned a lot from him. Quresh, as you can see, was wonderfully entertaining. So all of you guys must realize this. You can have fun while being good. And not that this is Sion, I was from KM, but being a geek is not good, not a good idea. Definitely, whether you're in KM, Sion, wherever. But focus on your goals, and as Quresh nicely put this whole thing off. Life is about what you make of it, not what others make for you. So I'll talk to you a little later, but thank you Quresh for coming in.
Thank you, sir.
Can you keep at least that?